We'll be starting in a minute. Hi PU. Hi Rishabh. So we'll be starting in another minute. We'll exactly start at 11. Hope I'm audible to everyone. Okay, thank you. All right, we're ready to begin now. So, good morning, everyone. I'm Dr. Rutuja. I work with ABTP as a senior physio, and today we're going to discuss about the most fearful rather than we all are seeking solution for this problem. So we're going to discuss how physiotherapy is going to help, or it's already helping a lot of people post-COVID rehab. So I welcome you all. We'll be discussing, it's going to be an interactive session. So I'm going to explain you how things are and how physiotherapy is already helping quite a lot of people. If you guys have any questions, you can put it on the comment section and we'll be addressing those. Um as far as possible, try and ask more questions so that you can help each other, and we all can overcome this COVID, which is just spreading across the world. So, getting back to what we are going to study or understand today is, so the impact of COVID has been really very various, and there is no fixed symptom for everyone. So everyone has different kind of symptoms. So you must all have experience either through some your own experience or through people who you already know who have undergoing different kind of symptoms. So some people have a lot of body ache, some people have no symptoms at all, some people have diarrhea. So these symptoms are quite variable, and it's very important for us to understand how it is going to impact. Though some people may not have any respiratory complications, still there are certain things that we all need to understand in order to start the rehab. So you, even if you don't have any kind of symptoms, it has residual symptoms which is going to affect you in the long run. So I'm going to discuss two aspects. So some people who have been hospitalized after COVID or during COVID, or and some people who have been isolated, and the impact on people who have milder symptoms or no symptoms at all. So understanding first people who have been hospitalized and people who have had lot of impact on their respiratory function. So they have been in ICU, or some people have just been admitted for about 15 to 20. Am I audible? So about 15 to 20 days. So that impacts a lot of physical functioning as well as mental functioning as well. So before we begin, I want to make sure that you all understand the impact which it has on the patients who have been admitted at first. So after hospital admission, people have been in a debilitating condition where they are not able to move. There is a lot of psychological impact on that. It affects the physical and the respiratory function. So any physio who comes into the hospital, there are two things that they address. First is the exercise capacity, functional capacity, physical capacity, and the lung capacity. So before addressing those, the assessment of a COVID patient during hospital is completely different, and post discharge is completely different. So if you look at the patients who have been discharged, any physio who goes to their home, first an assessment is quite important, because every patient has different symptoms and every patient is going to respond in a very different way. So as physios, whenever we go, first we look at the exercise capacity. So we use tests such as 6-minute walk test, or if the patient is really very old, then we use 10-meter test, because some people, even getting out of the bed is quite difficult for them. So assessing that is very important. So I request everyone not to follow any videos online and try exercising by yourself, because an assessment is quite critical. Even if you have the same disease, the symptoms and the way it's going to affect everyone is going to be completely different. So a physio or any doctor is going to assess you correctly in terms of understanding how much is your capacity, because even though you feel you're normal, sometimes your exercise capacity completely differs from what it was before. So even with people who have been hospitalized, people who have been taking treatment at home, everyone's exercising capacity is going to be affected. Your respiratory function, again, that is something that is under the closet. So not everyone is going to able to identify whether they have respiratory functions or not. So if the respiration is compromised, there are different tests that we use. We all are aware of oxygen saturation, so we all keep checking that. So again, that is one of the parameters. But apart from that, lung capacity is something that needs attention, and a physio or a doctor only can help you understand whether your lung capacity is functioning correctly or not. So I request everyone not to follow random videos and try and understand how you can increase the exercise capacity, or identify what is your capacity and how can you get it back to the normal. Second assessment which we focus is on physical functioning, whether the person is able to move around properly or not, whether the person is able to do his activity of daily living or not. Some people even climbing stairs, even the person is young, so age is not the factor. In COVID, it is extremely variable with different age groups. Even younger population is facing lot of breathlessness. People have had lung fibrosis and many complications. So that's why it is quite important to assess where your physical and respiratory function is. So these systems are completely related to each other. So if you are breathless, there is a possibility that your body is going to be tired. The physical functioning also will be affected if your respiration is affected. So oxygen is something that is quite important, and any movement you do needs oxygen. So we all are aware that oxygen is the main thing in the body. If the oxygen level drops down, we all are going to face a lot of weakness in the entire body. So understanding that and how much is your capacity post discharge, or even if you are at home, how much that is, it's going to be variable. After that, we're going to assess the muscle strength as well. So because you've been isolated, your activity levels are tremendously going to be low. So if you are isolated in a room for 15 to 20 days, you are just going to maybe walk around inside the room, or if you are very ill, you are going to be lying down on the bed. So understanding the muscle strength definitely is going to be compromised. So suddenly if you start exercising, suddenly if you increase your musculoskeletal exercises, that's going to impact your respiratory system. So that is why it is quite important to address how much strength you have and work out or plan your workout according to that. Then another important aspect is looking at the fatigue levels. So your activity levels and your fatigue levels definitely are going to vary. So after you are out of quarantine and you suddenly start to move around the way you were doing before, your fatigue levels are going to be quite a lot. So there are different scales that we as physios use to understand how much your fatigue level is, and based on that we prescribe exercises. So fatigue is something that even you should know in your day-to-day life. So if you are doing the things, or even if you are working out, or if you are just sitting in a place, you are an IT professional using your computer quite a lot, even sitting gives a lot of fatigue post-COVID. So that's something that you all need to address and take it slow, not start everything immediately. So improving your exercise capacity and respiratory capacity both go hand in hand. So an assessment considering everything is very important. Another aspect of assessment is cognition. So we have observed there is quite a lot of evidence that shows that cognition is also affected in some people. So even addressing that is quite important. We use certain scales, and through history taking and communication with the family members and the patient itself gives us an idea whether the cognition is affected or not, and addressing that definitely helps the patient. So assessment is something that is quite important, and I would really emphasize and I request everyone to understand why doing exercises by yourself is not very safe. So it is always a good idea to understand where and what is lacking, and then plan your treatment accordingly. Coming back to now the treatment goals. So treatment is something that you need to discuss with your physio or your doctor beforehand. What are your goals? So setting goals is something that will help you understand what is realistic, what is achievable, and what is not achievable. Uh, Setting goals is something that has to be time framed. So post covid, generally it takes 4 to 6 weeks or 6 to 8 weeks sometimes with very severe patients, but minimum 30 days or 4 weeks is something that you should give yourself to actually get rehabilitated and understand how you can increase your exercising capacity and respiratory capacity. A lot of people feel that they are young, so they may not be able to uh, they may not need any treatment, or they may not need any advice from anyone. But I would specifically suggest and stress on that unless and until you get yourself assessed, you may not know what exactly is happening, especially at the lung capacity. Physical is something that needs to be addressed. So if you've not been exercising due to the pandemic for the entire year, exercise is something that is going to help you build up your respiratory system as well. So setting goals again. So you have to set goals with your patient, with your doctor and therapist. You decide what you need to achieve, because this goal is something is going to be different for everyone. It also depends on what workout you do, what is your occupation, and what are you expected, what activities you do throughout the day. So everything is taken into consideration, especially when we design goals. So the treatment aspects are different. So whenever we design any treatment, we first and foremost manage the breathlessness, because that is something that scares the patients the most. So that is also named as pulmonary rehab. So that aspect of the treatment is the most critical one, because shortness of breath is something that really scares people. So we have to manage that first, as simultaneously we increase the day-to-day activities. So some people may directly start with physical workout or exercises if they have been previously engaged into any activities. But for, my suggestion is, do not do that. Take rest. Even if you have finished your quarantine after 15 to 20 days, you have to start slow. So you have to give yourself a month's time and then build up your activities gradually. So first is managing your breathlessness. So we teach how to exactly control your breathing. So breathing is something that has two aspects. So breathing at rest, so you increase the lung capacity by taking deep breaths. So there are some exercises that help you to manage control breathing. Then there are certain exercises that help you during your activity. So if you're doing, for example, someone has breathlessness while climbing upstairs, so stair climbing is something that's going to increase the effort which is required on your lungs. So that's why we teach paced breathing, where we exhale while doing a difficult task and inhale while releasing it. So again, that has to be preceded with an assessment where we kind of understand how much that person is able to take. So sometimes it is absolutely not advised anybody to use stairs or climb uphill immediately post discharge or even after a week. So it completely varies on where you stand and how COVID has affected you. So the breathing techniques are something that is going to help you exactly how you're going to move forward. So as I explained, there are two techniques. One is the paced breathing and one is control breathing, which you can always practice. Once you learn from your physiotherapist how exactly to do it, you can practice it throughout the day. Breathing also affects the mental health. So when you are quite breathless, your mental health is also affected. So addressing that and showing compassion towards your friends and colleagues will actually help you to manage the breathlessness as well. So because COVID has such a lot of impact on people. Some people are actually mentally affected that they have been detected with COVID. So that's something that we all need to help each other, make them understand that it is completely okay, and breathlessness is a part of it, because you've been on the bed rest. Even if you're hospitalized or not, still some people face breathlessness, and it is absolutely okay, and it is going to improve. Sometimes during breathlessness in the hospital or at home, you can even try positioning. So again, with a doctor's advice, you can understand how different positioning can actually help you relieve the breathlessness. So for example, lying down on side, or lying down on your stomach with different pillows under your body, or standing or sitting up upright helps people to manage their breathlessness. So instead of worrying about it, you have to learn the techniques how you can manage your breathlessness, and that will in fact help you to recover faster. The more oxygenation is there in the body, the better recovery is possible. Now exercising, after you leave from the hospital, we mainly have some objectives to improve your fitness levels, then again to reduce the breathlessness, to improve the strength. So strength training is at the end. So first we always focus on improving the mobility of the body. So the person should be able to move freely. Mobility in terms of your body, uh, flexibility of the body, and mobility also to move around in the house. The things that you were able to do, the activities of daily living that you were able to do before, you should be able to first achieve those without any breathlessness. So after that, exercising at the right level is also very important. So some people need to understand that immediately improving the exercise capacity is not possible. So while exercising, if you are able to talk and finish a complete an entire sentence, that means you are exercising too slow. If you are not able to complete, if you are having shortness of breath, or even if it's difficult for you to use any words while exercising, that means you're exercising too hard. So both are not good for you. So exercising at the right level is quite critical. So once you manage your physical activities and your breathlessness at the same time, that's how you're going to improve. The only aspect which you need to understand is you have to go slow. You don't expect improvement immediately. The improvement will happen eventually. You have to give yourself that much time so that you can see improvement in yourself. Exercise is something that varies, and that we always prescribe based on what you have been done before. So it has to match your physical activity capacity which was there earlier. So that's something that we all cover during the history or consultation, and we try to match the same exercise level which you can achieve. Coming back to the respiratory exercises, so I still would say that do not engage into exercises that are available online, because everyone's exercising capacity is different. You have to consult someone, you have to take your doctor's advice, your medications, it's a holistic approach mainly. You have to look at it from all perspectives, whether you're improving or not. Immediately after discharge, if you engage into your day-to-day activities, that is going to definitely increase the breathlessness. So set goals for yourself, set realistic goals where you can actually decide what is achievable and what is not. Based on that, you have to start your exercises. So physiotherapist, whenever does an assessment, it is followed by a treatment, and then end of treatment goal, which includes home exercise program, which you can follow after the rehab is finished. So it comes along with breathing techniques. It also comes along with right moving strategies and getting back to your work. So I would suggest immediately after COVID, try not to get back to your work. Take some rest, take some time out so that you can come out of it physically and mentally, and you're giving your body some rest. In a way, it can rehabilitate itself to the pre-COVID state. So it takes quite a lot of time, and it varies with different people. Some people who have been on ventilators, especially, they also have swallowing difficulties. They also have speaking difficulties. So the rehab for such patients is completely different, and those patients take quite a long time. So the symptoms are the most important aspect of understanding how we can address those. So people who have been hospitalized, it's quite evident that they are not able to do their day-to-day activities. However, people who are absolutely like very young and who don't have any symptoms, they just experienced loss of smell or maybe loss of taste. So some those people also have been affected with decreased capacity. They also have residual fatigue, and addressing that in those people is more important, because you may not understand that this person actually has breathlessness, or that person actually has reduced lung capacity. So that is something that as physios we address. People who have been hospitalized and who have come home after, so their rehab takes about 8 weeks, and that is something that we can easily address. So helping each other, spreading this, that the awareness of exercising not by yourself, because every person is different, everybody's body's capacity is different. Mainly COVID affects everyone in different ways, so addressing that is extremely important. Anyone has any questions? I'll just go through the comments. If anyone has any questions, kindly. Shailesh is asking, doctor's advice for 6-minute walk test not possible in small house. So do we do spot jumping? So no, I would suggest 6-minute walk test. If the house is small, you use a timer, and even if you are walking inside the room, that is fine. So it is a test only a doctor can do, and it also considers vital signs, and it is also taking into consideration that if you are able to walk for 6 minutes or not. So some people cannot walk for 6 minutes also after COVID. So for them we use a 10-meter test. So there are alternatives for 6-minute walk test also. Spot jumping is definitely not something that can replace 6-minute walk test. Spot jumping requires quite a lot of exercising capacity, and you can be immediately breathless, and we don't want to put a person in the situation where the breathlessness increases. So we have tests which we can address, but we don't have to make the symptoms worse. Anyone else has any questions? Any cure for blocked ears, 5th day of isolation? So blocked ear is mainly, it happens mainly because of cold. So there are medications, your doctor will be able to help you with that. And sometimes because of lot of cold and cough, the ears get blocked. So if you get in touch with your doctor and explain this, they will be able to suggest a medication for that. But if you are in isolation, so she has mentioned it's 5th day of isolation, so I would not suggest you to think about exercising or increasing your capacity at that time. If you are still positive, if you are still at home under isolation, I would suggest please do not worry about exercising and anything. You just have to take rest at that time. All you can do is breathing exercises. If you feel less breathless, if the breathlessness is quite a lot, then you can try different positioning techniques that will help you to relieve the breathlessness, but do not do any kind of other physical activities even if you are fit and fine. Anybody else has any questions? So we'll be keeping the commenting section open. Okay, someone has preventive breathing exercises. Yes, so as I said, for prevention, you can just do a deep breathing exercise where you breathe in through your nose and you exhale through your mouth in a very controlled way. Alright, and as you do that, you can place your hands beside your rib cage. Take a deep breath through your nose, and your hand should move sideways, so as if there is a lot of air inside your rib cage. So the rib cage should actually move outwards, and you have to breathe out in a controlled way through your mouth. So that's something that you can use as a precaution. Also, if you don't have COVID and if you want to increase your exercising capacity, what you can do is you can start with mild cardio exercises at your home. So maybe you can engage into walking at your home, or you can engage into some activities which you've done previously. This is only if you don't have COVID. So that's for prevention, improving your cardiovascular fitness. So Someone is asking any suggestions for asthma patients. So asthma is again quite critical, and you would need someone's help to address that, because it is just going to become worse. Already the breathing capacity is reduced. So for asthmatic patients, I would definitely suggest you have to have a doctor with you who can help you how to and teach you how exactly to breathe correctly. So controlled breathing plus paced breathing. So paced breathing is something how to manage your breathlessness while you are doing a particular activity. So that is something that a combination of both can be used for asthmatic patients. If they have symptoms during rest, then positioning is something that will help you when you are having those kind of symptoms. All right, anyone else has any questions? So just to summarize everything, whatever we have discussed, is COVID is something that has a lot of impact on people, and it affects every person in different ways. So addressing that is very important. And assessment is something that will actually help you understand what is lacking and what you already have. So if some capacity is already good, we use that as a treatment intervention when we design your exercises. So improving your respiratory function, improving your physical function, both are equally important. So addressing both the things is something that we design when we give any exercises. So it takes about 6 to 8 weeks. So if you have to design your exercise in such a way that you are giving yourself that much time for rehabilitation. All right, so I'm finishing this session. Anybody has any doubts, you can put it in the comment section, and then we can answer it later on. Thank you.